spent an afternoon with Lisa Edelman, and it's hard to believe rheumatoid arthritis once slowed her down.
It was really painful to get through the day. When I would wake up, I would be very stiff. Even after a shower, it would be hard to move around. During my day, it was hard to do anything with fine motor skills. So even holding a pencil was difficult, or typing.
Rheumatoid arthritis is an autoimmune disease that can cause severe joint and organ damage, debilitating pain, and disability. According to the Arthritis Foundation, the disease affects an estimated 1.5 million Americans, usually between the ages of 30 and 60, and strikes almost 3 times as many women as men.
Patients with rheumatoid arthritis find even simple tasks difficult to do. Getting up, getting dressed, putting on their clothes, and eating and grooming themselves and preparing a meal. These are things that don't need to be the case.
Lisa is living proof that when diagnosed and treated early, patients with rheumatoid arthritis can successfully manage their disease and live their lives.
It's due in great part to the medication, the conversations I've had with my doctor, and most importantly for me was changing my lifestyle, my eating and exercise, which 14 years ago was not the best.
In fact, studies show medications along with lifestyle changes can have great benefit. With that knowledge, Lisa today eats a healthy plant-based diet, exercises, practices gentle yoga, is a Reiki master, and a health coach. All this, she says, helps her work a sometimes demanding job as a florist.
There are holiday seasons that I'm sometimes there for 12 hours, 10 hours. And on my feet, my hands in cold water, using my hands, that would absolutely have been impossible for me even 10 years ago, probably.
Since I last saw you, have you noticed some improvement in the fingers?
Dr. Derek Todd says a healthy lifestyle is important, but emphasizes the right medication early on can stop progression of the disease and prevent long-term consequences.
We have newer biologic drugs that have been out for the past 10 or 15 years. And these have really very much changed the face of this disease to a favorable one. Our waiting rooms are no longer full of wheelchairs because of these medicines.
And while there is no cure, here's proof of how much the outlook for rheumatoid arthritis has improved. A decade or so ago, walking 3 miles at a fundraiser may have been impossible for some with rheumatoid arthritis. But on this beautiful Sunday morning in Boston, Lisa and about 1,000 others diagnosed with or touched by arthritis walked the Arthritis Foundation's annual fundraiser to find a cure and to raise awareness.
What we want people to know is that arthritis is a part of who they are. It's a part of their life, and it takes some work, but there are ways to work with your physician to find a complete, comprehensive management plan so that you can be in your life and engaged in your life, and don't let arthritis be your life.